Dear friends, ladies and gentlemen, it is really a great pleasure and honor indeed for me to invite each and every one of you from India and abroad to participate in a very important webinar. And this webinar is a world expert dialogue on azildipine or Zebla. This is really important, happening for the first time in the world. What is the theme of this dialogue? The theme is very clear that there will be discussion on CCB, focusing on azildipine in 2021 and beyond, its morbidity and mortality benefit, especially in hypertension inflicted catastrophe. We all know that the prevalence of hypertension is rising not only in India but in the whole world, especially the uncontrolled hypertension. I call this uncontrolled hypertension as a global tsunami and is a real public health problem with a very high morbidity and mortality. It is responsible for premature heart attack, brain attack, leg attack, and eye attack. The time has come. Early detection, early diagnosis, and timely intervention at the level of primordial, primary, secondary, and tertiary is the need of the hour. We are all aware of the guidelines from the Indian Society of Hypertension, International Society of Hypertension, ACC, AHA, European Society of Hypertension, Canadian Society of Hypertension, and various societies of the world on hypertension. And the guidelines recommend diuretics, CCB, ARBs, ACE inhibitors, and of course, compelling indications of beta blocker wherever required. But I must tell you that the guidelines are not guidelines. They are sidelines. They are a support system for us. We must individualize our patient depending on the need of calcium channel blockers and depending on the comorbidities which he or she has. Taking into the history of calcium channel blocker, it goes back to 60 years. Many molecules came like nifedipine, nitendipine, felodipine, and so many molecules. But our focus is for last few years is on three molecules. Amlodipine is with us for last 34 years. Cinedipine is for last 26 years. But azildipine is the newest molecule which is with us for last 18 years. Azildipine is the molecule of choice in the year 2021 and beyond, on which the whole discussion is based on this trilogue by very eminent personalities of the world who are the legends and luminaries and pioneers of this molecule, who will show us the data as to where do we stand today. Just to have a curtain raiser, I must tell you about the potentials of this molecule, that you all know that azildipine or Zeblong is an L and T channel blocker. It reduces the blood pressure, both systolic and diastolic. Its potentials are also to reduce the sympathetic nervous activity, thereby prevent the reflex tachycardia. And the most powerful potential is it does not produce peripheral edema, or if at all, it's very low or insignificant. It reduces the pre-capillary pressure and especially the pre-capillary hydrostatic pressure. We all know that we have 10 billion capillaries in our body. So this molecule acts everywhere without producing any edema or extravasation of fluids. And the BP reduction is quite gradual and sustained And it has been huge data to support by HBPM and ABPM the power and promise of this molecule in the BP reduction. It dilates both afferent and efferent arterioles of the glomeruli, thereby creating a balance. And the most important potential is it reduces the intraglomerular pressure as compared to other molecules like amlodipine. Amlodipine was considered as a gold standard for last many years. But I feel in the years to come, the gold standard may change to azithromycin. It reduces the proteinuria, which is a very, very powerful potential. It is 17 times more lipophilic as compared to other molecules. And the protein binding capacity of this molecule is almost 90%, which is a huge. So it is a cardioprotective and nephroprotective, which is very well known. It also reduces the renin levels and aldosterone levels. And aldosterone is a real molecule or real chemical which is toxic in high doses and may cause fibrosis. And azithromycin reduces the fibrosis in LA and LV and thereby reducing the LA stiffness index, reducing the LV strain and LA strain, reduce LV filling pressures, E by prime ratio. So that is a very powerful potential of this molecule. It also helps in retinopathy, diabetic or hypertensive retinopathy by reducing the precapillary pressure. It is also has an anti-atherosclerotic potential, reducing the intimal media thickness. A lot of data is there. So I'm sure there is going to be a lot of data discussion in this trilogue on coming Sunday, that is 8th of August from 7 p.m. to 8:30 p.m. It is metabolically, pharmacodynamically, pharmacologically, hemodynamically most friendly molecule. Ladies and gentlemen, in short, I must say that azithromycin or Zeblon is a cardio, nephro, neuro, retino, and vasoprotective molecule. It reduces the stiffness of the blood vessels. We always talk of benefit risk ratio. This is the molecule where there is only benefit and no risk. There is a plethora of indication, but as a curtain raiser, I may just tell you in brief that this molecule, azithromycin, is a molecule of first choice in hypertension in young or old, men or women, with or without comorbidities, with CKD, with systolic heart failure or diastolic heart failure, with reduced ejection fraction or normal ejection fraction, diabetes mellitus, obesity, with stroke, with CAD, with vascular stiffness, with COPD, atrial fibrillation. It can also be used pre, intra, and post-operative status. It can also be used in retinopathy, PAD, varicose veins when there is edema of the legs, DVT when there is edema of the legs, hypoproteinemia, and hypothyroidism. That's the potential of this molecule. Ladies and gentlemen, my final appeal to each and every one of you, once again, please join us in large numbers in this mammoth academic feast of the world by the world legends, pioneers, and luminaries of hypertension on a very brainstorming session revealing the data on power and promise of azithromycin in 2021 and beyond. A time has come. We should create our own protocols to use this molecule and see the benefits of azithromycin in our practice. Ladies and gentlemen, this is the opportunity. We must act locally and impact globally. We must inform, perform, reform, and transform the whole world on the usefulness of this more powerful molecule of calcium channel blocker azithromycin in hypertension to reduce the hypertension-infected morbidity and mortality. Looking forward to welcome you all and interact with you on this important tri-dialogue on coming Sunday, and we will have some consensus on the benefit and potential of this molecule in our clinical practice. Thank you very much.